Hi guys, Eric Beard back. Last video I built for you was at a seated rotational machine for the trunk. I wanted to point out another kind of common error that I see when people are performing a cable rotation exercise. Before we talked about too much movement at the lumbar spine, not enough at the thoracic spine. So cable rotations I see performed quite frequently. In addition to having the wrong parts of the spine moving and the wrong parts of the spine staying still, I see the setup or approach to this exercise done incorrectly. Now, I've got socks here just to highlight some important points here on the floor, and I'm not set up at the best line of pull to perform the exercise, but for the angle of the camera, this is going to work for us. So for a cable rotation, there are multiple different ways to perform that. The one that I would start off with most individuals is they're going to maintain a stable unit. When I work with my tennis players, when they talk about hitting the ball, it's called a unit turn. They're moving the entire trunk as one unit. We want the thoracic spine and the lumbar spine to stay neutral. So we're really teaching someone how to load the hip or internally rotate one hip as I come across and then transfer load from their lower body to their upper body. Or I'm going to see that with a hockey player or baseball player too, is we do want to teach them how to make sure that we're keeping our spine neutral or we're learning how to move the hip dependently. So one of the things that sets people up to fail, if that's the case, is we want to teach stability first, is they start with their feet externally rotated. This is how many people will walk in due to muscular imbalances, whether they're missing dorsiflexion, have imbalances through the hips, or they just don't know how to move or line up yet. But when you start someone off in an externally rotated position, they're not going to be able to have the range of motion that they need at the hips to perform this correctly. Most people are missing internal rotation at about 90 degrees. Wow, this is going to be interesting. This isn't going to go very well right now, but we should have about 45 degrees of internal rotation passively. That's not where it should be, but that's okay. Pay no attention to the deficit of hip internal rotation I'm showing you. But we should have about 45 degrees of passive hip internal rotation. Now, when we're in this position, I measure almost everyone's hip I take that back. I measure everyone's hip internal rotation that I see, and everyone's got a deficit. I've had very few people. I've had 2 to 5% of individuals coming to me with optimal hip internal rotation. Those individuals are typically gymnasts or cheerleaders, people who have a high degree of hypermobility, usually too much. One or two other individuals that I've seen, but usually 2 to 5% of the people have good hip internal rotation. Most people are missing it. So if I start externally rotated, they're going to have no prayer of internally rotating the hip. I'm shortening the piriformis and the other deep six lateral rotators. I'm shortening the glutes. And if someone doesn't know how to disassociate the spine from their hip and their pelvis, it's just going to cause excessive transverse plane forces through that lumbar spine, especially the L4, L5, L5, S1. So let's just go over some examples right here. Initially, we want to start off by keeping the lumbar spine and the thoracic spine lined up. But if someone's locked up here and someone doesn't move very well and can't stabilize very well, then they're going to have a hard time moving through the hip. They're going to create more motion through their sacroiliac joint. And we know that low back pain is so prevalent in the U.S. 8 to 10 out of individuals in the U.S. are going to suffer from that on an annual basis, at some point in their life, significant enough that they'll either miss work or they'll have to see a physician for it. We know it's rampant. SI joint pain is correlated with hamstring injuries as well as hip internal rotation deficits. And we also know that SI joint pain can oftentimes feel like low back pain. People can't differentiate between sacroiliac joint dysfunction pain and lumbar pain. So, that being said, don't start people off like this. Now, if you're doing something for a reason, someone's a little bit more progressed, they have good rotation, you're just having them set up in a different position, a different pattern to load their body or system a little differently, hey, go for it. But you have to have the rotation at the hips, you have to have the stability through the center of the body first. So my recommendation, feet hip to shoulder width apart, relatively straight ahead, engaged through the core, and it might look just like this, where I'm only moving my shoulders. I'm keeping my spine and my trunk still. I'm looking for core stability first. Now once someone can maintain that intervertebral stability and then the lumbo-pelvic stability, and I'm just offering these perturbations with upper extremity movements, now I can start to focus on some internal-external rotation. I'll exaggerate what I'm doing with my feet here. That's why I have the socks showing here. But my spine is still not moving. My upper extremities are not moving. They're staying integrated with my trunk. But now I'm getting hip internal rotation and external rotation. And I'm going to require some symmetrical movement from the hips to do that. And help people learn to load their hips. Now once that's learned, we can start to actually get a little bit of transverse plane motion at the thoracic spine integrated with the hip movements. Now we can always change the resistance, we can change the plane of motion, we can change the velocity at which we move, we can change the load, all those things. But we're talking just about some cable rotation progressions, and one of the things that shoots people in the foot, no pun intended, is their foot alignment to begin with. They start externally rotated, they lock up the sacroiliac joint, they don't allow their hips to internally rotate, causing sacroiliac joint dysfunction, more lumbar dysfunction, and they end up missing the boat. So definitely multiple ways to go ahead and execute this exercise, but start off feet hip to shoulder width apart, controlling that intersegmental stability and lumbo-pelvic stability first. Start with upper extremity perturbations, get hip internal and external rotation, and then start to integrate transverse plane action through here. The clients will get massive results from this over time with effectiveness as well as decreasing risk of injury. And on the athletic side, from a performance perspective, when they start to really get up there and start to move with explosion, with an integrated movement from the big toe out through the pinky. I'm Eric Beard. Thanks so much for watching. Have a great day.